Helen is a specialist general practice nurse, a researcher, a lecturer in Digital Health and Informatics, and a clinical research lead at the Australian Digital Health Agency. Helen contributes strategically and operationally to the delivery of the highest standard of healthcare in community and primary healthcare settings. With her keynote, please give a very warm welcome to Dr. Helen Almond.
Helen. Wow, that sounds impressive. I've not met that person yet. Anyway, digital health in Australia and what it means to the nursing profession. I was just reflecting back when I saw my title for this talk. I've been in primary care nursing for 40 years. No, I was a child nurse. I really was, when all of you are working that out, but wow, 40 years is quite something, isn't it? And I remember in those days, I was actually working with neonates, and the only way neonatals' information and vitals was actually recorded was if they were in intensive care. So any pediatrics, it was paper. I worked with paper records. Here I am today talking about digital health. How the heck did that happen? I actually got an interest at first when I was working in Stockport in England. That's south of Manchester, for anybody that might know it. Very near Manchester City rather than Manchester United. Anyway, I was working there and I worked on a major highway. Lots of diesel fumes chucking out of all the lorries going along the highway there. And what I actually noticed was every address along that highway that we saw in the general practice had at least one person I was seeing for asthma management. So what you know now as asthma action plans. And I suddenly realized that I was actually collecting data. So when I was getting ready to talk today, I thought, actually, that's where my health information, my health informatics actually started. Immunizations, collecting that data regarding asthma management. And then it went on from there, diabetes, and it just grew and grew. When I came to Australia, I was very involved with chronic disease management and developed templates, again, collecting data. Then I realized when I moved to rural Tasmania that I was actually approached about this thing called a personally controlled electronic health record. I don't know whether you remember those days in 2012 when the personal electronic healthcare record was launched, and then in 2013 they decided to do the Royal Inquiry and suddenly put the brakes on Australia's digital health record until they got it right. Anyway, the rural community I was working in actually wanted a better way to access their healthcare information and access healthcare in a timely way. So we started some research, and we actually started using the personally controlled health record, or the PCHR that it was called at that time, and started introducing it. We all actually registered for a PCHR and started uploading our information. We went to our general practitioners, and these people all had 2 or more complex chronic conditions. Actually, in the research, they had 5 complex chronic conditions each when we actually collected the data. And they started using it. They never once complained about it. They never once asked about the privacy and security of it. They all asked to actually, and their relatives, be part of the research, because by this time, the University of Tasmania had invited me to do my PhD. So we were going towards a PhD as a community. I was doing the writing, they were giving me the information willingly. We ended up with 3 groups and 29 individuals all partaking in this. As I say, never once was asked about privacy and security from these people. I actually had to build the question in. Some of them told me they would never look at it again, but they wanted their healthcare professionals all to use it. By this time, it was called My HR, My Health Record, sorry. So I really did find that people, healthcare users, want my health record. What we haven't done as an agency is particularly get out there and do the education right. And I think the Digital Health Agency would agree with me with that. Now, I know you heard from Louise this morning. She's a good friend of mine, obviously, Digital Health and Informatics, and she's a very dynamic speaker as well, which is slightly concerning for me, stood here right now. But she was telling you about how America are coming at us hard and fast with Google, Amazon, Microsoft, all knocking at the door, all challenging our data security. There has never been a breach of my health record in its time since 2012. So I'd like to reassure you all of that. I also want to reassure you that Australia is the only continent, and I mean continent, that has one shared digital health record. And that's something we should be applauding. Of course, there are areas where it can improve. Of course, we need critical mass in it. But it really is something to applaud ourselves. We've got a really, really large nursing cohort now in primary and community care, and we can really, really contribute to the health and the health outcomes of the healthcare user these days. So what I would like to do is now tell you you all know we've gone through the opt-out period, and the opt-out has now been decommissioned from 1st of February. Everybody that hasn't opted out has got a My Health record. After saying that, if you don't want a My Health record, you can delete it. If you then decide you want one, you can reload it. You can take it off and put it on as many times as you like in your life as a healthcare user. So what I want to do is go through now the digital health strategy for roadmap for delivery. It's a framework for action that's going to promote collaboration and information sharing, developed by all Australian governments, industry and providers. It acts as a guide for organisations recalibrating their work programmes to deliver national priorities. Those are those across the top. Priorities are going to be delivered by 2022. That's only 3 years away. That's a lot of work. Health information that can be exchanged securely, made available when and wherever needed, standardized so that it can be shared in real time. So opt-out finished on the 1st of February, as I told you. So here's some key facts and figures. As of the 18th of March, 23 million have My Health record. That equates to more than 90% of the Australian population, 90% of a continent. Pretty impressive. 15,500 healthcare provider organisations are registered. That includes nearly 7,000 general practice organisations, more than 800 public, 200 private hospitals, 4,500 pharmacies, and 200 aged care services. 2.4 million documents and 33.5 million prescriptions and dispense records have all also been uploaded. Opportunity, collaboration, coordination. This is what this looks like. Yeah, there are still some yellow areas on that, areas we can improve, but they're improving daily and really don't pay a lot of attention to it. It's the statistics we have to actually work towards, but look at the amount of green that's on there. It's fantastic. We're going well. So where to now? We're on track. Consumers have decided if they want or don't want My Health record. Increased clinical document uploads are happening. We need, as usual, behaviour change. We need to work with that. So how are we going to do it? Accenture built the My Health record system in 2012 in the PCHR era. There is a need to embrace the new technologies coming on board. The agency are in consultation at the moment, and the National Infrastructure Operator contract ends in 2020. So there's work going on all the time to modernize that re-platforming. It won't stay the same. Nothing does. Secure messaging is a national priority. In 2020, America and the UK will cease fax transmission in healthcare organizations. Australia haven't set a date yet, but it will follow. So we're going to have a global, we're going to have a national search directory where you'll be able to look up healthcare provider information, send and receive information securely, and end paper-based methods in healthcare, reducing the risk of clinical harm, improving coordination of care, and have a national platform for e-referrals and care planning. Interoperability, going to have consistent, connected care, identity management, I am who I say I am, authentic and authorized, I can't even say the word, I need a drink. Authentication and authorization. As a clinician, I can access information needed to provide care. As a consumer, I can access information and control who accesses it. Integrated electronic health records. My health information is available to clinicians involved in my care. Unified health directory services. I can easily find a healthcare provider I need to communicate with electronically. So what are we hoping for in 2019? Industry-agreed communication models for standards, interoperability maturity, frameworks to support information and procurement and adoption, reference sets that contribute to consistent information change, and diagnostic services recommendations. Medicine safety. You can read the figures there. 150,000 shared medicine lists have been uploaded already to My Health Record nationally. A solution architecture has been defined and validated. Conformance framework is drafted and the blueprint is being endorsed. Incredibly important. So there are priority health areas. National digital health collaboration. The achievements to date. There's a governance established. There's a baby book. Minimum data sets have been harmonized across all states and territories. Aboriginal Torres Strait Islanders and culturally and linguistically diverse consumer persona, all that work is complete. In 2019, we expect to complete pilots on the digital health record started in New South Wales. Work on digital pregnancy healthcare records and child digital health checks. Work on business cases and transition plans to a national infrastructure. Now, in enhanced models of care, there are test beds, and I'll have chatted to quite a few of you over the last 2 days about these. There's actually 15 of them addressing national health priorities. These test beds assess newly digital-enabled models of care to promote innovation, to address Australia's highest priority and health challenges. And what I'm going to do is quite quickly, but we're going okay for time, whiz through the test beds, reducing, firstly, the first test bed, reducing hospital readmission. Develop and implement and evaluate a program that will increase the engagement of people soon after their discharge from hospital with their community pharmacist. Pharmacists will optimize the medications using information provided by discharge plans via My Health Record. Pancreatic cancer. There's a development of a mobile app for pancreatic cancer patients to allow them to more effectively manage their condition, and treatment plans in near real time, collaborative with the multidisciplinary teams. Actionable cancer patient perspectives, incorporation of patient-reported experience measures into routine clinical practice and timely response to feedback, now widely recognized to improve clinical outcomes, overall quality and safety of care. Testbed 4, continuity of care for prisoners. Now, not many of us realize, and hopefully not many of us realize, that when you go into prison, you hand over your Medicare card. All your healthcare is actually provided by the prison authorities, and it's good healthcare for prisoners. They probably are receiving the best healthcare they've actually received throughout their lives. However, when they come out, they are left without a Medicare card. They have to re-establish that Medicare link and then re-establish a relationship with primary care, community care. So there's a test bed that will use My Health Record to develop a coordinated information transfer for a patient journey from prison to primary care. Testbed 5, medicine safety again at transition of care. This objective is to research the measures and produce evidence of the benefits of more effective medication management at point of admission and discharge from hospitals, and also demonstrate scalability. Cabeza pathology are looking at a system that presents 13 years of historical pathology results. This has the potential to improve patient care, specifically for patients with chronic disease, by making this historical data available to treating clinicians at point of care. There's an enormous amount of work going on behind the scenes. It has been going on, and it's continuing now for this next year. Health data interchange. This is going on again in New South Wales. Western Sydney Diabetes, in alliance with 120 member organisations, are working to beat diabetes together. Each entity has information and an array of data that they are willing to share to inform and drive the initiative. Machine learning tool. Through this research project, the machine learning will link with emergency presentations and general practice data to develop a decision support tool and predict patients' risks of re-entry to ED. Enhancing My Health Record view. To provide general practice with a view of My Health Record that provides contextual clinical workload, a capability and useful relevant information to quickly and work on quickly and efficiently. By giving the context of the data in the record, we'll be providing a mechanism by which general practice can easily view changes and compare their workloads. Private specialists. This is a big area of work. Connective amongst private specialists, enhance share care models and drive an increase into digital maturity of private specialists. This is an area that is slow and steadily taking place, sometimes reluctantly, but hopefully we can move this forward. Closing the aged care integration gap. This is another area that is just taking its time. So we're going to progress it. Mainly in Sydney North are doing the work at the moment with secure messaging and My Health Record to connect residential aged care facilities with general practice, pharmacy, acute care hospital avoidance providers, and shift the focus to My Health Record as a primary conduit for exchanging health information. Cardiology care. This is a test bed that will investigate how My Health Record can be optimized to support the management of low to immediate chest pain patients through rapid access cardiology clinics model of care. Just at this point, 2 weeks ago, my husband suddenly announced to me he didn't feel very well. And we had to call an ambulance. I obviously have been with My Health Record myself since 2012, and because he's my husband, he's also had a My Health Record since 2012. That's not saying anything, and there's no bias there, of course. However, he became very unwell very quickly. We called an ambulance, and even of a nurse of many years, as you've heard that at the beginning, when I healthcare provider is shouting at you, can you tell me what medications he's on? Has he had any past history, etc.? I took his mobile phone off him, and please don't do this bit. I know his passcode. I went into his passcode, I went into his My Health Record app, Health Eye it is, opened it and went, he's on that, does that help? So when it's a loved one, and I'm quite sure I shouldn't go into his password or any of those things or know them, to have that My Health Record quite possibly saved his life. He went on to have a quadruple bypass, needs some work on his aorta, but today he's waiting for me to finish his talk to catch a plane back to Melbourne. So I'm very happy that we have a My Health Record, and I'm very pleased to see this as one of the testbed sites. On to testbed 13, improving self-management. Healthy Go Share digital patient education platform enables health professionals to send their patients customized bundles of credible health resources with the aim of providing integrated care for complex chronic disease management in Aboriginal Torres Strait Islander communities. 14, I'm nearly there with these test beds. Digitally enabled palliative shared care. Enhance patient care, care engagement and self-management through patient portal connected to end-of-life information. Healthcare providers and My Healthcare. That's what's going on in South Australia and Northern Territory at the moment. Testbeds. There's a MediTracker mobile app now. This aims to empower patients with chronic illness again to better manage their own care. Using the mobile app as a portal, they'll be able to see their care and really be able to empower their healthcare provider. Now, the workforce education, you met Louise this morning, as I say, a very dynamic person, wonderful person. She's actually leading the CXIO initiative through HISA. I'm not sure whether she mentioned it this morning, but it's a national network of champions who are working to improve digital health and identify areas that could be strengthened. Continuing professional development, we're working with the peak bodies to build continuing professional development training for those healthcare providers that are actually out there to get everybody up to speed. My Health Record training, that's been going on for a while. The PHNs are more than happy to come out to general practice, community providers and communities to really support My Health Record. And clinical reference leads, that's peer-to-peer work, that's me. I'm a clinical reference lead. I'm one of 45 across Australia, so we are working hard to get it right. Also, my work as a lecturer in digital health, I'm actually at Swinburne University, but there are other universities doing it. We're working on undergrad curriculum to develop future-ready students, future-ready healthcare professionals, data managers, business managers that are all aware of the impact of digital health on the healthcare user. I prefer to think of digital health as nothing about me without me. It's a well-known phrase. It's been around for a long, long while. It is not my own phrase. But if somebody asked me what My Health Record was about, I'd say nothing about me without me. Again, a little anecdote for you. Maybe about a year ago, a bit longer than that, when I was uploading a shared health summary, I said to a patient, so you're happy if I upload this health information into My Health Record? And they turned to me and said, why are you putting it in your health record? And I said to them, no, it's My Health Record. Yes, I heard you, Helen. Why do you need my health in your record? And I went, let me show you. And we were going round in circles, so I said, the government have decided to call this My Health Record. It's your health record. It's not mine. So it's long been a story that I share with other people that I actually say when I'm talking to patients, I'm going to call this My Health Record in a minute, but it's not mine, it's yours. And that's very much it. Nothing about me without me for a person. We also have a mental health toolkit. This is a toolkit that's actually to help the healthcare providers, introducing my healthcare system and its benefits, registering my healthcare, connecting the system to the organization's IT, privacy, security, and consent obligations, information in a person's health record, and upload information, and who to contact for health and support. Remember, your PHNs have an absolute wealth of support. If they don't, the Digital Health Agency will also help you. So there's an enormous amount of support out there to help you. And the website is a terrific resource as well. There's training modules, there's modules that you can actually go onto your clinical software, the conformance software. There's lists of conformance software. That's the software that works with my health record. There's so much information out there now. But actually, the Australian Digital Health Agency, as I started with, is actually more than just. It's about bringing. It's about getting that clinical mass, that information into my health record now through the framework. So, how are we doing? How is Australia doing? By global standards, Australia ranks the highest on administrative efficiency and healthcare outcomes, and is amongst the top ranked countries on care processes and access. However, we do know there are problems in the system. We're not that naive. These need to be addressed. For example, 1 in 3 practices will see a patient for whom they have little or no health information. And that's even though we've got 90% of people now register on my health record. They are empty pockets at the moment. Many patient records are still created as paper files. They are regularly transmitted between healthcare providers using unsecure email and fax machines. The introduction of digital health system will help reduce these issues because the content is shared digitally between clinicians and patients, means reduced risk of lost information. Medicines information availability securely online reduces the patient's safety risk. People and clinicians will be able to see the results of previous tests. So the digital health benefits for nurses and for people. Pre-birth, content shared in my health record means reduced risk of loss of information. Adults, digital tools make it easier to access services remotely. Medicines information available via my health record reduces the safety risk. And for seniors, people and their clinicians will be able to see those results of previous tests. Thank you.